We have Krishna Kumar with us.
Yeah,
Welcome aboard, Krishna. Krishna comes from Oasis Investment, which is part of the Shirawi group, and I'll hand it over to you now, Krishna. Thank
thank
you.
you very much. Thank you very much, Indu, for introducing me. First of all, everyone, wish you a very happy New Year, very vigilant and vibrant New Year. And finally, the vaccine is available, so people are quite happy with the new outcome. So basically, I am supporting an organization called Oasis Investment Company. We are one of the largest business conglomerate in UAE. We are a UAE-based company with more than 34 companies. And we have a wider interest in manufacturing, facilities management, or construction, contracting, logistics. Our business industry are more than 5 to 6 sectors. And we have 31 companies in the organization, and which has been represented and holded by Oasis Investment Company under the name of Al Shirawi Group. So today in this presentation, we are talking about three important aspects, which is resilience, agility, and innovation as a part of our business practices during pandemic times. So resilience is basically how well we recovered from this particular fallbacks. The first time when the incidents has occurred in Wuhan, in China. So how as an organization we have taken initiatives internally and what kind of process we have introduced internally. Agility is basically talks about how we maintain the new normal. Okay, so how we have come across the new normal and how we maintain it and how we performed during the new normal. And the innovation basically talks about the new innovations which we have inculcated as a part of the process, and we have identified new processes to follow up and new activities to be taken care so that the company will perform and create a new revenue structure altogether. So let me introduce my steering committee. The moment this first incident was occurred in UAE, that is on 28th of January, we came to know the magnitude of the problem which is going to happen, because we are actually closely seeing each and every day-to-day activity reports, even WHO website, and we came to know it is going to be a pandemic, because WHO took some amount of time to declare it as a pandemic, but by the way it is actually happening, it is spreading across the group. I came to know that, okay, this is going to be a major event which is going to happen. And we know this is going to be a major pandemic which is going to happen. So we created a steering committee immediately. So the steering committee was headed by Mr. Naveen Valrani, the vice chairman of the company. And then Mr. Pramod Rijiria, the chief operating officer. And Mr. Manish Sharma is the CFO, chief financial officer, and myself as GM for QHSC. So we created a steering committee way back in January itself. Because January 10th, I still remember the date, January 10th, we thought about this particular incident is going to conquer, and definitely this pandemic is going to be a global incident. So then we thought about this incident, and then we made it a steering committee by that time itself. And what we have done as a first activity is creating a contingency plan. So that first and foremost, what we done, a steering committee was formulated. Then we created a very comprehensive contingency plan in February 2020. Subsequent to the first case was reported in 29th of January. So our contingency plan is a well-defined document which actually talks about 4 levels of control, which is called, talks about yellow, amber, green, and red. So if you want to see my contingency plan, you can also see in my website. It's available in our each and every company's website, which is COVID-19alshirawi.com. And this contingency plan is actually getting updated every day. And I can say whenever a new revisions comes in the legal requirements point of view, this particular contingency plans also gets updated. Currently, the revision number 7 is actually got uploaded. So this is actually a new plan which talks about how to plan for each and every contingencies and how to support the business continuity in terms of business excellence. So we talked about yellow, that is Be Aware campaign. Then second one is amber, that is Be Prepared campaign. Third one is a green, that's Extra Care campaign. And the red one is Take Action campaign. So each and everything has been supported with a well-defined and well-defined management programs. Resilience is the first one we talked about. That is basically to talk about the awareness section. Here, daily review of WHO situation report, SAHA, MOH websites, and COVID-19 policy updates have been done. So what we used to do is actually during the time in January, February times, we used to take the WHO situation reports. It was a daily situation report which is given by WHO, which talks about number of mortalities, number of fatalities, and how the spread is actually progressing. So we have done this analysis every day, and every day there is a daily meeting with our committee members to understand what is the magnitude of the problem. So we created a dashboard, and that dashboard is talking about the fatality and mortality rates, as well as how this incident is actually spreading in UAE. And the first incident in Shirawi group of company, which has happened on 22nd of February. So from that day onwards, we created a well-defined dashboard. I will also share with you the dashboard what we have created. So immediately after understanding the issues and the level of the problem which this particular incident is going to happen, we created 41 workshops. These workshops are actually all across our units, including our accommodations, our workstations, and even, for example, in the sites. They're mainly to give an awareness about how this particular disease, how dangerous it is, how contagious it is, and what kind of preventive measures you need to take. So we talked about three main things: hands, face, and space. We talked about hygiene. We talked about importance of wearing masks and maintaining the social distance of minimum 2 meters while at work. So this was a main campaign we have taken care as a part of our workshop campaign. Then we created an awareness campaign at labor accommodations. There are more than 41 campaigns in the labor accommodation, same kind of labor accommodation campaigns we have conducted. And we also had a tie-up with major hospitals like Amina hospitals, Tumbe hospitals, NMC hospitals. I understood the importance of having different stakeholders engaged right from the day one, so that this kind of engagement activities has been done, so that whenever any incident happens, we can directly report them and immediate care can be provided. So special campaigns on COVID-19 prevention with the subcontractors and validation of the response plan. That is another one which we have done, because we are into construction. So it's very important. We need to see what subcontractors are doing, because 80% of our works are done by subcontractors at the site level. So what we have done, we told them to have their own risk assessment. If they are finding difficulty of doing the risk assessment, we will go to them and then we tell them that this is the way the risk assessment has to be done, and created a separate service level agreement with them. And our subcontract agreements also modified to make sure that, okay, COVID response plan is a part of the process. Allocation and approval of special budget for PPE is very important. That during the time of February, March time, we found that PPEs are very high amount of scarcity here. We are finding even a small mask has to be bought in 17, 18 dirhams. So we thought about having a special assignments and special elements for budgets for PPEs. So we have created a separate budget for PPEs, and that budget was, the management was very supportive to ensure that, okay, everybody gets a pressure treatment on PPEs are concerned. So we got a special budget for that particular PPEs. Email signatures on COVID-19 preventive actions for communication. That was another one which we have done. Each and every employee's email signature was talking about hands, face, and space as a part of the campaign. This is the statistics which we used to share with the top management, which talks about the COVID-19 activities. So here, the COVID-19 active cases, recovered cases, fatality, total cases, and recovery rate. This is the main summary which you used to give to each and every day's our daily discussions. And we also talk about the percentage of positive cases, either in blue collar and white collar. So to understand which segment is actually getting affected. So for your information, I can tell you that during the first phase, the impact on blue collars were more than 70%. But in the second phase, the impact on white collar is more than 79 to 80%. So there is a radical change or shift in terms of number of people getting affected in the first phase and second phase when I monitor the statistics. So this kind of statistics and database management system actually enable the organization to take fruitful and fraudulent decisions actually. Resilience in terms of Ampere side, what we've done is we create an emergency response team. An emergency response team consists of 11-member team from different sectors, including transportations, procurement, and even I can say safety, security, these aspects. And this emergency response team is actually working as a catalyst of giving the preventive action measures to each and every employee related to COVID-19. We also created a COVID report form as well as self-declaration form. Two things we have created immediately. COVID report form is a form which is talking about how much people have been affected and what are all the direct and indirect contacts. So there is a separate form which has been created, which is an online form, which can be filled very easily and it can be stored in the online itself. Then we allocated to a 90-room facility for quarantining, direct contacts and isolating affected cases. We have created a separate room facility for them. And these facilities have been given for labor separately, for staffs we have given separately. Recruited additional nurses for employee well-being. We have, that time we understood the need of care. Then we talked about having more nurses. Till that time we have around 8 nurses. We increased from 8 to 12. So that was the main thing which we have done, so that at least people will get adequate care, and these people, the nurses, became a part of emergency escalation team. We create a competent team to handle disinfection and sanitation requirements. The the best part which I want to share here is basically one of the subsidiary company, Shirawi Facilities Management, was a company which was doing disinfection and sanitation. We immediately made sure that okay, this disinfection and sanitation is done as per the DHA requirements, and we tied up with DHA and we got the special approval from DHA to work as a disinfection and sanitation team for all across our facilities. So with the help of Shirawi Facilities Management team, we made sure that okay, all the disinfection and sanitation has been done in a world-class way. Special arrangements with the hospitals and clinics to handle emergencies. So we have created a separate cell in each and every hospitals where they can work for us. Like I had signed a separate agreement with NMC, with Tumbe. So a separate key account manager has been appointed to handle only Shirawi cases, so that emergency cases can be handled with a high amount of priorities. These are all the amber category preventive measures we have taken: vehicle disinfection every daily, self-declaration form, daily sanitation for all the workstation, camp disinfection, very important, every daily disinfection on the camps, acrylic protection on our dining area, and we have a, what you can say, staggered entry and exit process in the dining process. Seating arrangements have been done with the proper signages. Thermal scanning is also a part of our process. All the facilities, more than 11 facilities, we have a thermal imaging camera, including camps. Resilience point of view, being extra care point, policy of work from home and its benefit got promoted. So we have a special campaign where we talked about the work from home as a main policy, and every employees have been told to work from home during the time when the pandemic is at its high spike. Mental well-being consultation program has been arranged in association with the well-being with the leading hospitals. So what we have done is we tied up with Tumbe Hospital and NMC Hospital. Some doctors have been talked about the importance of well-being, and we had a special campaign on mental well-being. You can see the campaign posters here. Additional 15 days has been added as COVID-19 sick leave as a part of the paid leave. That was another, what you can say, the welfare measures we have taken. Then we also have a weekly town hall meeting to inform the employee-centric policies on a monthly basis. So whenever we have any policy changes has been happened, you can see one of the policy change, just talking about the sick leave policy. Whenever any new policies happens, that sick leave policies and everything has to be communicated to the concerned stakeholders. And weekly, we used to have a campaign on this one through the process of what you can say, town hall meetings. Resilience on REDs. RED is basically when it is actually a person has been affected, what we have to do. So we have implemented emergency handling procedures for the people with symptoms, regular monitoring and reporting of health condition through chat rooms. For example, if an employee has got a specific ill and he is bended to ventilators, or if he is bended to a high emergency, we have created a separate chat room for him to discuss about what exactly is going to happen for that person day to day. We have 2 cases where the person has went up to the ventilator, but fortunately nothing had happened, no fatalities, but person has come out. But to ensure that okay, daily care has been provided, the emergency escalation team has created a separate chat room for them. Mental support for the family members through employee welfare committee. So a separate committee has been created for those people who are mentally and physically affected after being affected with the COVID-19. So this welfare committee will work across the time to ensure that a well amount of support is given on mental well-being is concerned. Business continuity and technology, effective implementation of back to office policy to support business continuity. So we have created something called a back to office etiquettes. So which talks about what are the things to be done when you come back to the office. This has happened in the month of September, where we told them that, okay, we can have a kind of reporting that for initially 50%, then 60%, then 90%, then 100%. So we have told them to have a staggered amount of reporting back to the office. And what is the process? It is also well supported with the etiquettes. Office renovation designed by imbibing COVID-19 protocol. Some of the major offices we have revamped by having a design protocol of minimum 2 meters distancing, which I can show you in the next slide. And we've also done installation of UV lights on decks for pathogen-free air circulation. So basically, there is something called UV lights, which protects to provide a clear air to the facility. So we have had a tie-up with the Sandovox company. They provided UV light rays, as well as we provided this one as a part of the free air circulation inside the building. So we have done an engineering control where our decks has been installed with the UV lights, so that it will provide a free air without any pathogens. Advanced indoor air quality measures through installation of UV system inside the equipments, that is also be done. I think we are the only company who had done this kind of UV light installation in the UAE. Advanced biometric system in all locations so that we can have an hand-free entry. That's the main intention here. These are all the works we have done. Back to office etiquettes, which is talking about the minimum 50, 60, 90, and 100%. Then we have what you can say biometric systems and censored what you can say this hand systems. We have done mass level training to all our workers. We have also done cleaners separate section on how to clean the process. You can see the UV light installation, the fifth picture, and the sixth one is the kind of rearrangement which we have done with the 2-meter distance as a part of our revamping process of our offices. Consultation program, recovered patients, consultation from eminent doctors on COVID-19 for those recovered, reintroduction program for HSC and consultation from nurses for a week on health condition. Whenever a person gets recovered, we have done a reintroduction program to them, where we talked about what is exactly their BMI, what kind of problems they may face. Some people have some mental trauma. So how to handle that mental trauma, the reintroduction program has been conducted. We've done a regular BMI analysis on all the employees who reported back after having affected with COVID-19. So we have around 134 cases in the first phase, and second phase till now, till this time, we have around 70 cases. All these people who have been affected, these people have been given regular mental well-being training. And training on mindfulness, the importance of yoga, the importance of having breath exercises, all these things has been given as a part of the campaign. So how to get business opportunity from this adverse situation was the last one, which is talking about innovation. So we have an innovation manager. He come up with an idea to have an innovation hackathon to identify the business opportunity and capitalize on them. So what we have done is we done at least a mass level innovation hackathon, an online hackathon where the innovation manager talks about what kind of new business processes we should enter as a Shirawi. So what we have done, we identified Al-Shirawi Healthcare Solution as a subsidiary now. We formulated Al-Shirawi Healthcare Service as a new company in September 2020, so that this particular company will take care of the requirements of healthcare requirements. Then introduce Radar Mascot. That's a mascot which is talking about the importance of reaching out, anticipate, discover, analysis, and reflect on behavior. This mascot is a new mascot which has been introduced to communicate our day-to-day COVID-19 plans to each and every employee. And this particular communication program became more effective because of this introduction of Radar Mascot. We also created HSC passport with COVID-19 prevention guideline. That's also got released, and the CEO is actually reading that particular passport. You can see that. And venturing into new product lines, Al-Shirawi disinfection and sanitation services, Al-Shirawi firefighting and fire alarm services. So new business setups has been made during this pandemic time. So all these 4 companies which we are talking about, all these companies are got established in September to December 2020. So this is the way we reacted, because we seen a possible, what you can say, a new business opportunity during the time of even the complications, during the time of when uncertainty is there in the market. Thank you. That's all my presentation. Any questions?
Thank you very much. That was a fantastic and very well detailed presentation, Mr. Krishna Kumar.
Thank you very much, sir. Thank you.
Yeah. Thank you. If there's any question from anyone, please unmute yourself and ask him a question. I will take 2 questions.
Hi, can I ask one question?
Yes, Shabin.
Yes,
It
Sabine,
was a
please
great
do.
presentation and all the knowledge we gained from it. So just would like to know, what is Innovation Hackathon? Like, if you can just brief little bit about it.
Yeah, fantastic question, Sabine. What we have done actually, Innovation Hackathon is actually, it's a kind of process where we will talk about different setbacks what the organization has had in the last 1 year. For example, we are having cancellation of orders. We will talk about, okay, for example, some technology is not working. Sometimes people are not paying. All our problems will be set as a part of the process, and we will be telling that, okay, these are all the setbacks we had in the last 1 year during pandemic. And let's identify, right, brainstorm and identify some solution for this particular setbacks what we have. So ideally, it's an issue-based thinking where we will talk about the issues, what are the things we have faced, and how to make these particular issues into positive change. So Innovation Hackathon is basically issue-based thinking where an innovation manager drives this process. So every company, we have, I told you, there are 34 companies in the group. So the company's major subsidiaries have a lot of problems. For example, some people, they have a cash flow issues. Some people have not in a position to support the business with the good vendors. Some vendors are run away. So in that case, we need to ensure that, okay, the business continuity has to be maintained. So to ensure the business continuity, what we can do, that's the main thing which we have done as a part of Innovation Hackathon. So it's an issue-based brainstorming section.
Thank you.
That was excellent. And if there's anyone else who has a question. Yes.
Yes, ma'am.
Yes, Rais.
Yes, Mr. Krishnakumar, we just wanted to ask you, like, you were telling in between your presentation, like, you had tie-ups with the hospitals.
Correct.
We were just wondering, like, can you please guide us, like, how you actually got the tie-ups for the same thing? Because we also, I mean, struggled to get the same thing.
Correct. It's very important actually during the kind of pandemic, to be resilient and have a good amount of what you can say understanding with different stakeholders. So what we have done is actually the moment this pandemic happened, the steering committee has told us that let's have a tie-up with all major hospitals. So what I have done is actually I have done a mass level impact, a level survey on which are all the hospitals who is actually working for COVID-19. So I have understood, I can say one is Al-Futtaim Group, Al-Futtaim Health Hub was there. And we have Tumbe Hospital, we have NMC Hospital. So these are all the major players who are there in the market who is actually working for COVID-19. So what I have done immediately after this particular hospital has been identified, I went into the system and I have a separate meeting with each and every top officials of this particular hospitals, saying that, okay, Shirawi is a big group. We have this much as manpower. So can you please put one person as a key account executive who can handle our cases? So we straight away went and had a discussion with them to have a separate key account executives who work for our cases. So even if I send somebody for COVID-19 test today, I have a key account executive who is working for me, who will ensure that, okay, report will come within 24 hours. So even if I send a person today, I can tell you that within 24 hours, I get the report because we have a special tie-up and that key account executive only work for us. So I think you people have to take that initiative forward, identify the key hospital who is working for COVID-19 and have a one-to-one discussion with them and to create a separate key account executive inside the organization or inside the hospital to have work for you. That's the main thing which you have to do.
Right. Thank you, sir.
Thank you.
Excellent. Thank you very much, Rais, for that question. I was wondering about that because a lot of people will benefit from that question as well. So thank you for both the questions as well as for your presentation, Krishna Kumar.
Thank you.
And I'll allow you to go on mute now.